Welcome everyone. This is the Applied Radiology MR case study video series. My name is Ashim Bhatia. I'm a pediatric neuroradiologist at the Children's Hospital of Philadelphia. This is another case of the series. The current history for this patient is a previously healthy 4-year-old presenting to the emergency department with a lump on his head. So the patient presented to the emergency department and a CT of the head without contrast was obtained. You can see a large scalp mass, which is heterogeneous, extending into the calvarium within the right frontal bone. There's erosion of the right frontal bone involving the outer and inner table. It almost looks like there's extension into the brain here on this slice. If you go to the bone window, you can see more clearly that there's erosion of the right frontal bone. So you have a lytic lesion with a scalp mass or soft tissue mass on the CT of the head without contrast. The question in this case was, is there extension into the brain? So an MR brain with and without contrast was obtained. And you can see here on the gradient sequence that this scalp mass is heterogeneous, actually has fluid level. So this is a susceptibility demonstrating layering blood within the scalp mass. And then again, you can see there's extension through the calvarium. Another sequence that's helpful in this case is the axial T2 sequence. Again, you can see the fluid levels. It's a very heterogeneous mass. There's extension into the calvarium. And it looks like there's involvement of the brain parenchyma. But what's really helpful in this case is if you administer contrast on MRI, you can see that the mass has heterogeneous enhancement. It's more clearly defined that this mass extends into through the calvarium involving the dura. So here's the dura where you can see the enhancements. So there's dural enhancement. But what's clear with contrast is that this mass does not extend through the dura into the brain parenchyma. So this is, again, the coronal post-contrast T1. And so gallium-based contrast agents are helpful anytime you have a mass involved, whether it's within the brain or outside of the brain. And again, here's the dural enhancement. Here's relatively normal brain hair with no dural enhancement. So this mass does involve the dura, but there's no intracranial extension. And so cases like this require further workup. So the main thing on your differential in the pediatric patient would be Langerhans cell histiocytosis, possibly metastatic disease. Part of the workup with oncology included a bone survey. And here's just some examples of the bone survey where you can look for other involvements in other regions of the skeletal system. And in this case, it was an isolated right frontal calvarial lytic lesion with a soft tissue mass. And it was proven with pathology that it was Langerhans cell histiocytosis, which is a rare granulomatoous systemic disease that is more common in children than in adults. It can present as palpable masses. Like in this case, more likely in the calvarium, but other common sites would be the skull base and the maxillofacial bones. The most common imaging finding will be a well-defined skull lesion demonstrating significant enhancement, whether it's with MR, so gallium-based contrast agents, or with CT. You also have pretty diffuse enhancement. And you're looking for osteolytic masses on CT like you did in this case. The bone survey is helpful for looking at other regions of involvement within the skeletal system like we discussed. And you can also have involvement of the central nervous system, which is less common. And so if you look at the case report that's associated with this case, you'll see further images and discussion of CNS involvement of Langerhans cell histiocytosis. And so if you have a well-defined lytic lesion involving the calvarium, skull base, or maxillofacial bones, displaying enhancement in the pediatric population, you should include Langerhans cell histiocytosis in the differential. Familiarity with the CNS involvement can also aid neuroradiologists in making an accurate diagnosis. So thank you for viewing this MR case study on Langerhans cell histiocytosis.